This is the Health Matters program. I'm your host, Alicia Martin. Today we're talking about treated bed nets distribution to strengthen malaria elimination across Guyana. Joining me on the program is Dr. Kishana James and Dr. Olivia Valls. Welcome to the program, Dr. James.
Thank you.
So we're observing World Malaria Day on the 25th of April. Could you tell us what is the significance of this day?
All right, so thank you for having me actually. So World Malaria Day is a day that we commemorate every year on the 25th of April. Basically, this day highlights the efforts and the strengths and all the activities that have been done within a country leading towards malaria control and elimination. It is a broad category of different activities such as diagnosis and treatment in terms of their management of malaria, in terms of how they combine their efforts not just at a local level but also at a regional level to combat malaria as well. So this is the whole significance behind the day.
Thank you so much. This year, you guys are launching the mass net distribution campaign, and I'm very excited about this. Tell us what this is. What can the public expect?
Sure. So for the mass net distribution campaign, this is an activity that happens every 3 years. We did have the activity in 2021, and now come 2024, we are here again.
Yes.
So normally the Ministry of Health, the government of Guyana, we normally procure the treated bed nets and hammock nets as well. So for Guyana, we do the distribution within the endemic regions, or the regions that has high burden of malaria cases, regions 1, 7, 8, 9, and also additionally now parts of region 10 where you have a lot of mining and logging activity. So for this year 2024, we decided to align the mass net distribution campaign with the World Malaria Day activity, and we're going to have a grand launch within the region 9 Aishalta Marudi area, specifically this area because we're targeting our mining camps, our mining populations, and the more vulnerable populations. And as we know, within Guyana, malaria is related in somewhat to mining. So we want to reach to those persons. We want to make sure that those populations, they have prevention and protection against malaria. So we do have this activity happening on the 26th of April. We do advise that all persons can come out and uplift their treated nets. You need a form of ID, any form of identification, ID card, driver's license, birth certificate. If you're owner of a mining camp, you can walk with your mining permit with the number of persons within your mining camp, and you will be able to uplift your nettings, whether bed nets or hammock nets as well.
I'm totally excited for those persons over there in Region 9. They will be able to get their free treated nets on the 26th of April. After this date, where can persons pick up their nets?
Okay, so after the 26th of April, all the health facilities within the region, they will have nets. So you can go to your various health facility or your nearest health facility and you can uplift nets. This is for Region 9. Across the board, let's get excited for the other regions. They do have the same mechanism. You will have a launch within each region as well. The dates for those launches, it will be announced later. You can either check the Ministry of Health Facebook page, or you have the Little Mosquito Big Problem Facebook page. So you can check those pages and you will be updated on the dates for the launch within the regions. And likewise, subsequently to the launch, you will be able to collect your nettings at the health facilities as well. We're also collaborating with the mining organizations such as GGMC, GGTME, Women Miners Association, Forestry and Labor. So we will be also distributing nets to those organizations. So once you are linked or you are working under those organizations, you will be eligible for a treated nets as well.
Thank you for providing that information, Dr. James. Could you talk a little bit more about the importance of persons not just collecting the bed nets, but using them correctly?
Oh, please. Thank you. So for the treated nets, we know that these nets are intended to last 3 years. They are treated because they do have a chemical. So one of the things is the net, the importance of the net, it helps to protect you and prevent the bite of the mosquito as well. So once you have that net around you, it covers a circumference around you that keeps a distance between yourself and the mosquito. In terms of caring use of the net, what do we do advise? When you get the net, at least you air the net out at least 24 hours in a shaded place. You don't want to put it in sunlight, direct sunlight, where it can be damaged or the chemicals can be damaged by the sunlight. In the morning when you do wake up, whatever you can do, fold up your net, tie it up so that it doesn't get damaged with wear and tear and what's not. In terms of if you find that it's getting nasty or dirty and you want to wash your net, we do advise that you can wash your net, but mild detergent such as maybe blue soap and water. Please do not wash it in the creeks and the lakes. Please do not put it in a washing machine. Please do not use bleach because all these are more chemicals and they can also cause harm to other people. I know we do have a tendency, some of us like to do fishing with the nets.
Yes.
So please avoid this because as we say, the nets do have chemicals and can be harmful for the inside of the body. So there is a whole brochure with the descriptions and directions in terms of how to use. And if you find that you have any reaction that is you're not accustomed to while using a net, you can visit your nearest health facility as well, and you can have more guidance in that area.
For the persons in Region 4 and Region 3, what can they do? How can they join in malaria prevention? We don't want them to feel left out with all that is happening within the regions. So what can they do?
Definitely. So if you're on the coastal plain and you're thinking that you might get malaria, if you're traveling to the interior and you're thinking you might get malaria, you do have your preventative methods in terms of one, using your treated nettings. If you intend on traveling to the interior, you can uplift a treated net to go. You can either uplift it from Central Georgia here, or you can uplift it right in the region as well. Then you have your preventive measures. You use your mosquito repellents. You use your long sleeve clothing, preferable more light clothing because the dark one tend to attract the mosquito. And you try to keep your surroundings as clean as possible to eliminate any form of breeding sites or so, because you know mosquito water, they tend to have that whole habitation there. Yeah.
Thank you, Dr. James. We will go into a break and be right back.
When you hear she buzzing, big problems coming, big problems coming, big problems coming. Look this little mosquito, big problems coming. I said this little mosquito, big problems coming. I was lying in my bed when she come hustling. You see it's nighttime and she got a need for feeding. Suddenly she bite me, and before I know it, she left me with a itchy feeling. Them boys are drink the concoction, but I remember seeing this and free malaria test that catch me eye. So I go down by the landing, free treatment all them man giving. So I decide to take the test that it say yes. Avoid wrong treatment, don't take the risk. Get the facts and show you know this. The full treatment is best, or the malaria gon' only rest. Look this little mosquito, big problems coming. I said this little mosquito, big problems coming.
Dr. Valls, for those persons who are listening and viewing us today, could you tell us what is malaria?
Okay, so malaria is a vector-borne disease caused by the Anopheles mosquito, and the vector part simply means that it's an animal, or in this case an insect, coming into contact with a human.
And how is this transmission done actually?
Through an infected Anopheles mosquito, infected with a Plasmodium parasite, biting multiple times a human. So when we say Plasmodium, there are more than one type of Plasmodium, about 5 types of Plasmodium that infect humans, but only 3 of those are found in Guyana, which would be the Vivax, falciparum, and Malaria.
I know we mentioned earlier that malaria is more prevalent in regions 1, 7, 8, 9, and 10. But for persons in Georgetown and, you know, throughout the coastlands, can they too get malaria?
Okay, so that needs a little bit of explanation. So when we say Guyana has endemic regions, we mean that endemic means it regularly occurs in these areas. In this case, regions 1, 7, 8, 9, and parts of 10, especially Frenchman Back Dam. So for you to get malaria, you will have to have the vector that is infected, and you will have to be in the regions that is endemic. So you can be infected in those regions, but not in the other regions, because we don't have the vector outside of those regions.
Thank you so much, Dr. Valls. What symptoms can persons look for?
Okay, so you may experience fever, headache, chills, cold sweat, loss of appetite, muscle and joint pain, a little bit of nausea, some vomiting, and then when it gets really worse, diarrhea.
Okay, I know a lot of persons usually like to wait until things get worse, and most times persons like to use their own home remedy. What would be your advice to persons who would have experienced these symptoms, and especially in those regions as mentioned before? What can they do? Where should they go?
Okay, so there's multiple things to pick off there. So if you are traveling to an endemic region and you experience any of these symptoms within 24 to 48 hours, you should seek testing or care at a health facility. Almost all health facilities across Guyana, even outside of the endemic regions, do malaria testing. So once you go, you get the test and there's a diagnosis, then we can treat you. Let's say you travel in, for example, you're a driver, you travel in, you take a load in and you're coming back to town, and then you start experiencing the symptoms. Then you come to the malaria clinic on Middle Street, Georgetown, above outpatient at GPHC, and we can run the test for you and then determine whether you have malaria or not.
Let's talk about the importance of persons taking their treatment to the full length, completing the full treatment. I know there would have been cases where persons would have taken their treatment, their medication, but when they think they're feeling better, they just stop right there. What would be your encouragement to those persons?
Right. So the first step is knowing that we don't recommend prophylactic or preventative treatment. In order to treat the malaria, you have to know what type of malaria you have. And in order to know what type of malaria you have to be tested. So you need to get tested first for us to determine what type of malaria you have, and then we have specific treatment for that. As I said earlier, we have 3 types of malaria in Guyana, so we have treatment specific for those types of malaria. So when you take the medicine, you'll start to experience what we call alleviation. You start to feel a little better. It doesn't mean that you need to stop. Each type of malaria has a course of treatment or a number of days that you have to take the medicine. So if you don't complete that, guess what? The parasites reproduce and they start the second cycle and another cycle. And then within 2 weeks, you would feel sick again.
I know you guys would have been doing a lot of work within the regions, a lot of sensitization and awareness and so on. What has been the experiences and the responses from those persons within those regions?
Well, people don't want to be sick. So everybody's always excited to know that if they do get sick while they're trying to work or visit family, that testing sites are available everywhere, not just in the public sector. We also have a volunteer network that works within the mining camps where we train ordinary miners, even in the logging community, housewives, shopkeepers, to do testing for us. So if you experience any signs that or symptoms, then you go and get tested, you get treated. So everybody's actually very happy that unlike before where we had limited places, now we have more places. We keep expanding. Wherever you go, we go.
With the mass net distribution coming up soon, what is the significance of this for those persons within those regions?
Right. So one of the most effective tools we have to preventing malaria is the treated insecticide net. So these nets will be available across the endemic regions to cover not just the fixed population, which would be the villages, also the mobile population, which would be the mining camp and the miners. They're very mobile. They go wherever the prospect is. So they should be able to take their nets wherever they're going.
Thank you so much, Dr. Viles.
Thank you.
When you hear she buzzing, big problems coming, big problems coming, big problems coming. Look this little mosquito, big problems coming. I said this little mosquito, big problems coming. Look this little mosquito, big problems coming. I said this little mosquito, big problems coming. I was lying in my bed when she come hustling. You see it's nighttime and she got a need for feeding. Suddenly she bite me, and before I know it, she left me with a itchy feeling. Days pass, I'm back in my bed, don't know what I'm doing. Suddenly what she left me with a broke up feeling, a broke up feeling. Big problems coming, big problems coming. When you hear she buzzing, big problems coming. When you feel she biting, big problems coming. When your skin starts itching, big problems coming. And when you start scratching, big problems coming. Look this little mosquito, big problems me don't take the risk. Get the facts, I sure you know this. There's a difference, yes, between Vivax and falciparum. I got to know which one I got so it don't come back. The full treatment is best, or the malaria gon' only rest. If I drink the right and full treatment and sleep under my net, this little mosquito won't be a big threat. When you ready, buzzing, big problems coming. Big problems coming. Big problems coming. When you fishy biting, big problems coming. Big problems coming. Big problems coming. When your skin start itching, big problems coming. Big problems coming. Big problems coming. And when you start scratching, big problems coming. Big problems coming. Big problems coming. Look this little mosquito, big problems coming. I said this little mosquito, big problems coming. Look this little mosquito, big problems coming. I said this little mosquito, big problems coming.
Dr. James, we know that malaria is preventable as well as curable. What would be your words of encouragement to our listening and viewing audience?
All right, so indeed, malaria is preventable and curable. And for the persons that might be in the endemic regions or the high burden regions with malaria, what we do advise these persons to do whenever you find that you're having any form of signs and symptoms such as fevers, headaches, chills, whatever it may be, that you can find your nearest health facility and you can be tested. And once tested positive for malaria, you can be treated as well. Additionally, one of the things that the program and the government of Guyana has been doing, we have been working along with camp owners, maybe cooks within the mining camps, anybody that is interested in the services, and we normally train these persons to use the rapid diagnosis testing kit within the camp. So then they have the privilege of actually testing anybody within the camp that is feeling sick, and they can also receive treatment. So normally sometimes you're passing through the regions and you would normally see a nice little blue and yellow flag mark free testing, free malaria testing. So you can actually also visit these sites. They have been identified by the ministry in the program to do malaria testing and diagnosis. So my thing to you is that at any point in time you think that you have signs and symptoms of malaria, we have a lot of theories, we have a lot of myths. Please just put it aside for once and just have the test done and use the treatment as prescribed by your physician. So yeah.
Before we wrap up today's program, could you tell us what can we look forward to coming out from the vector control services?
So definitely. So for this year, there is a lot of innovations and a lot of things that we're pulling together. For example, we have a more in-depth and precise cooperation and collaboration with the mining camps. So you're trying to get the mining sector on board with malaria as well.
Yes.
So you're going to find your mining organizations from time to time being pulled on board. We're signing what we call a memorandum of cooperation between the different organizations. As mentioned before, GGMC, GGDME, Women Miners Association. So from there, from time to time, we have, as they have persons coming under their umbrella, we will be able to also have those persons trained before going out into the field. So that is one of the things. Precisely towards Region 9, we have what we're piloting currently is an AI intervention that helps basically to digitalize our records so we can have more real-time data and how to apply this to the population and treat persons as is. So these are some of the interventions that we're working on currently, and we're hoping also to expand them to the rest of the regions as well. So yeah.
Thank you so much, Dr. James, and I encourage you guys to keep up the good work that you are doing at the Vector Control Services.
Thank you.
Thank you for staying tuned to the Health Matters program. I'm Alicia Martin saying goodbye for now.